something that money can buy is what the conversation is all about, because you need to be healthy for you to get out there to pursue the money and amass all the wealth you can for yourself, for your family, and then maybe if you're in the mood to be generous, you might extend a hand of fellowship in the spirit of the season to people around you. But we're saying this to say that December 12th every year is celebrated as the International Day for Universal Health Coverage. According to the record, it was first celebrated sometime in 2017, and it's been on so far. In September this year, September 21st precisely, the United Nations High Level Meeting on Universal Health Coverage reaffirmed the healthy people are the foundation of a healthy society and economies, and universal health is central to achieving all of the Sustainable Development Goals (SDG). Staggering revelation coming in from the United Nations. In addition, half of the world's population does not have access to essential health services. An estimated 2 billion people face financial hardship due to out of pocket health expenses, including 344 million people living in extreme poverty. We could go on, but let's begin to move on as we meet our guest this morning. Our guest to help us make sense of this day, the celebration. The theme is Dr. Folasade Fadare, medical practitioner and representative of the Association of Public Health Physicians of Nigeria. Good morning to you.
Good morning. Thank you for having me.
Good morning, Dr. Fadare, and welcome to Lagos Talks. Now, today is also International Migrants Day, and with the Japa syndrome, there have been a lot of concerns about Nigerian healthcare workers who are choosing to perhaps emigrate to other countries where they can go with their skills and perhaps, like they say, have a better working environment, a better working conditions. And still talking about access to healthcare, how significant of a problem is this in Nigeria?
Well, the migration of health workers is very, very alarming. And I need to say that we could not actually blame anybody moving out. And from time immemorial, health workers have always moved out. But the issue of staying there is the problem. In the early 70s, most of our doctors actually study abroad. They study in Glasgow, in Ireland, and immediately they finish, many of them find themselves back in the country, university, teaching hospital, and all that. But the issue on ground in Nigeria is that the economic situation is biting hard. People are not really finding it funny. Our take home is not really taking us home. And so all these factors are making people to think, I want to go out. And actually we say, go out, do well, and come back. That is what we need to work on now. We need to make our country attractive so that people, even when they go out, they get themselves better and they bring that wealth of experience back to make our healthcare provider and our services better. Because as you know, everyone, wherever you are, have right to quality healthcare without experiencing financial hardship. Paying out of pocket is experiencing financial hardship. And it does not make people go to the hospital on time. Because if you don't have money, you wait until when you get money or until somebody bails you out. And so by the time you get there, the condition may now present with complication. So we are actually begging, I personally begging our government to let us have an enabling environment. If we have an enabling environment, we will not move out.
All right, thank you, Dr. Fadare, for that. Let us know what your thoughts are. If you have a question or a comment, the WhatsApp number is 0809 440 You can also tweet at smooth981. Phone lines open, so you can give us a ring as well. 0144899981.
All right, so we would like you to help us get a proper understanding, because this phrase has been bandied a whole lot, and most often than not, it is bandied. People jump on the bandwagon and may not have an understanding of what it's really all about. So help us when we say universal health coverage, what are we speaking about, and what are those services that it incorporates?
When we talk about universal health coverage, we are talking about quality health care. When, where, whoever needs it. It doesn't have to be that you are in Lagos to have a quality health care. You can be in Zamfara. You can be in Zabarmawa in Sokoto and still have a quality health care. That is what we are saying. And you don't need to experience a financial hardship. You don't need to think twice before you go to the hospital. So we are looking at everyone being able to access care when they need it. And one of the way you can access care when you need it is to have already purchased a health. And so we are looking at every Nigeria at whatever level purchase a health care package. Now we have Nigerian Health Insurance Act, which makes it compulsory for everyone in Nigeria to buy into one form of health insurance or the other. In Lagos State, we have LASHMA, the Lagos State Health Management Authority, that is ensuring that at least the minimum Lagosian have Ilera Eko. Ilera Eko is the least package that anybody can have, and it takes care of husband, wife, and 4 children. And so you can access healthcare from any health facility, even if it is a private hospital. There are some that have been subscribed under the LASHMA package that you can access. So you must at least do that one as your primary responsibility. Because if you don't buy into your health, if you have problem, then you may have to experience some financial hardship, which I don't pray for anybody. Anybody could be stuck. But when you have a package, you can actually just access it. As you know, health is wealth.
This also takes us to the question of the perception that when you this universal healthcare is usually managed by HMOs, they are part of it, and then when they are mentioned, your mind goes straight to it must be private institutions, hospitals you have to go to. So I'd like you help us understand: can people access this universal health coverage by going to government hospitals?
Yes, if you go to government hospital, I will always cite Lagos State as an example because I work in Lagos State. Lagos State civil servants are already having a package. So as a civil servant, you sign in and you go to any health facility that you have decided to patronize. I mentioned Ilera Eko. Ilera Eko is for people that are not working in a corporate. When I say corporate organization, you are not a banker, you are not. So it talks about a laborer, a organizer, a one man
Business.
persons, and all those set of people. It talks about tailor. Buy a healthcare for your family at a controlled price. For now, 40,000, but I want to tell you 40,000 is still low. We are still advocating for a review because the 40,000 is for a year for a whole family, husband, wife, and 4 children. And it takes care of even cesarean section. It takes care of angiography. It takes care of append. So it takes care of almost all the healthcare need of a family. It takes care of hypertension, takes care of diabetes. It takes care of blood transfusion if you need blood transfusion. So you can imagine with 40,000 a year, you are covered. But the problem is that many people are not aware. You may not even pay at once. You may pay instrumentally. So all those ones are there, and that is why I am happy to come out to let people know what is there for them to access. Many of them don't know. And so I'm encouraging at least Lagosians buy into Ilera Eko. And when we talk about HMOs, This takes care of corporate organization. As you know, any employer of labor must take care of the health of their staff. And so the HMO is to help to regulate and be a binding between the health service that these people are entitled to. So you don't have to be an employed person to enjoy universal health coverage. And in the last week, the president also launched into the universal health coverage. And so I believe many other states will also come up with how they take care of the health of their citizens.
Okay, this also takes us to the availability of these facilities because now I'm glad you mentioned last week what the president, the activity that the signing in of those investment in relation to health, and the governors from the states were there to do that. But according to the Minister of Health, who mentioned as we speak the availability of just 8,809 primary health care centers across the country, being helping people to achieve this universal health coverage. How possible is it?
Well, I will just say that the journey starts somewhere. Even the staggering number of primary healthcare facility, how many of them are active? I happen to travel around Nigeria to some extent. Many of them are just a building. No health worker, no facility. So people are not going there. We need to revamp all our primary health care facilities because that is the closest representation of government to providing health care in whichever locality you find yourself. So we expect that every local government, every ward, to have a functional primary health care facility who is able to take care of the essential health care of the people that are around and who is able to identify. I remember one of the talk is that there should be at least a doctor in the PHC. The good thing about Lagos State, every local government have a flagship PHC, which means in the flagship PHC there are minimum of 3 doctors that takes care of essential health condition that could present. When I say doctors, they are qualified doctors. They are not quack. They are able to identify, manage, and refer to the next healthcare facility. And also a minimum of 1 secondary health facility in every local government. So we are sure that we will get close. I wish other governments will emulate Lagos State and have such. They can start somewhere. It's not starting that is the problem. Once they start, we will get universal health coverage for all.
Our special guest this morning is Dr. Folasade Fadare, and we're speaking about access to healthcare as well as the effects of migration on this access for Nigerians. You're listening to Lagos Talks. Do stay with us. The conversation continues shortly.
Listening to the Smooth Breakfast Show.
What does future forward banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providus Bank for you to take care of your daily experiences. At Providus Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providusbank.com to switch to a future forward banking experience. Providus Bank. Future forward banking. Providus Bank. Future forward banking.
Smooth 98.1. This is Lagos Talks. It's a Monday and we're talking about access to healthcare for all Nigerians. Now, the theme is time for action. Now, to you listening, I'm curious about this. What are the challenges that you faced in your journey to getting healthcare, not just for yourself, but also for your family, perhaps? Do you feel like you know what you're entitled to? Do you believe that your family is truly covered? Are there any concerns that you have? Well, this is the time to let us know. The WhatsApp number is 0809 440 You can also tweet at smooth981, and the phone line's open. So you can give us a call as well. 014489 Our guest is Dr. Folasade Fadare, medical practitioner, and she's a representative from the Association of Public Health Physicians of Nigeria. Doctor, I want to ask, what are the biggest challenges that individuals face when it comes to actually having access to this healthcare?
Well, I will be very truthful to you. Many of our facilities are overstretched, and so you will hear no bed space. I remembered when I was working at Mercy Street Children's Hospital, and in those days there were traffic, and it takes God for you to get to Mercy Street, and you get there, man, there is no bed space. Really, there is no bed space. Everywhere is filled up. And so, not many of us, when I'm on call, I try to create bed for the people that I don't even know that are coming. I try to make discharges and all that. Because I know, how will somebody go through those traffic and we get here and we say there is no bed space? Where are they going to? That is one problem. You remembered about 3 weeks ago, we learned that a teaching hospital had to close up some of the ward because there are no health workers to work. So that reduced the bed space. That is one thing. Another thing is, people say, I don't know anybody. And so when I get there, I don't even know where to go. So those are the things that we as health workers are addressing. You don't need to know anybody. Universal health coverage says it is your right to have a quality health care anytime you need it. So go to any hospital, and if you have complaints, there are complaint boxes anywhere. You can go and see the MD. That is one thing we do in Lagos. Go and see the MD that I am here, I've not been attended to, and or you are there, you can also see that they are working. It's just that the crowd is much. So those are things that people face every day. We need to be truth with ourselves. Some hospitals are overutilized. Some are oversubscribed. So those are things that we are faced. But I want to tell Nigerians, we that we have not jackpot, we are here to serve you. So encourage us, appreciate us. Don't see us as your enemy.
All right, let's go on to the phone lines. Good morning. Name and location, please.
Okay, I guess we'll call back.
All right, you know the number 014489
In your earlier opening, you mentioned the minimum will be as low as 40,000 naira, and from what you see, it's still not enough to give you all the services you mentioned that you can get access to. But I go back to that event in Abuja where it is the country is looking to raise as much as 2.5 billion US dollars in order to get this done. But in a time when people are asking the government to get their hands off subsidies and other issues in the financing of universal health care, do you see this as possible given the spirit of the time?
Well, it is possible if we are all faithful, if we are all accountable to every dollar, every pound, every naira that we have decided to use to spend on universal health coverage. It takes dedication. And I want to tell you, the problem that we are facing is not in terms of money alone. It is more of governance and administration. Putting the right people at the right place, mobilizing the right resources to where it is needed. When we look at that 40,000, you know, when we talk about insurance, it is pulling risk together. You pull it together, believing that, oh, not everybody will be sick. But I want to tell you, Nigerians want to spend their money. How can I pay 40,000 and I will not spend my money? So even if they are not sick, they go to the hospital. I must collect paracetamol. That is not the spirit of health insurance. The spirit of health insurance is some pay and they may not need it. So they augment those that need it. But I want to tell Nigeria, the first thing is that, please, let us live a good health. Let us eat less, exercise, and be in health so that we don't have diseases and health conditions.
All right, let's go on to the phone lines. Good morning. Good morning, Chika. Go ahead, please.
Good morning.
I can hear.
Chika, you have a lot of questions. All right, thanks for calling and sharing your thought, asking a question. Let's go on to the phone lines. Good morning. Very well, thank you. Name and location, please. All right, Mr. Francis, go ahead. All right, Mr. Francis, it's so unfortunate that this happened to you, and we surely do feel your pain with regards to the subject. But we'll let Dr. Fadare speak now. Thank you for calling and sharing your thoughts. Is this something that happens, unfortunately, in the healthcare system?
Well, it is very unfortunate, Mr. Francis, but I want to tell you, it is actually truth that it does happen. And I will tell you a personal experience. Just yesterday, somebody called me and said, my wife that I called you about was given appointment till February, but presently she's not feeling fine. I told him, don't stay at home, go back and tell them that my situation cannot wait till February. Let them look at what is happening to you now. I've had a case of sending somebody to a hospital, a very emergency case, and she told me they gave me appointment. That was in October. They said I should come in January. I said by January, they will have even forgotten that you are alive. I had to start managing the patient. The truth is that the queue is much. If you are sent to a consultant, they have what they call a list, the number of people that will be seen. And so if a consultant is going to see a patient today, he already has the number that he will see. Probably if emergency comes in, he can slot in one or two. So you can imagine. It still boils down to the issue of inadequate manpower. But I will beg you, I will beg Nigerian, if you are sick, please don't stay away. I do tell people, if you keep quiet, then nobody will help you. You need to be persistent until you get your health care. We are trying. We may not be able to give you all, but please, I beg you, don't stay away. I share my number to many people just because I could at least counsel you what to do. Because if you have appointment at any teaching hospital, it is number. If you miss that day, you're on your own. No. Because they are on appointment. And that is why I keep saying, please don't wait until you are sick. Go and take what we call how to maintain a good health. Balanced food, good weight, control salt, and all that. Then I want to say that though the budget is saying, okay, 20% for health, even if it is 9%, let it be released. Over the years, they will budget 9%. You may not get 3%. So that's why I mentioned that every one of us, we need to be dedicated to what we are talking about. Universal health care may start somewhere. The primary health care we are talking about will start somewhere. Most Lagosians look at primary health care and they say, I can't go to primary health care. I'll go to St. Nicholas. Go to primary health care. Go to primary health care. It's close to you. There are doctors there. In Lagos State, there are doctors there. I know in other states, they are still trying to make sure they have the necessary health workers. Thank you.
All right, we see the phone lines buzzing. When we return, we'll take more of your phone calls and your messages. This is Lagos Talks on Smooth 98.1. Stay with us.
This is Gold Swag, Gold Swag. On Smooth 98.1. The smoothest dial on Lagos Radio.
Wow.
Providence Bank. Future forward banking. What does future forward banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providence Bank for you to take care of your daily experiences. At Providence Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providence Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providencebank.com to switch to a future forward banking experience. Providence Bank. Future forward banking.
Driving in Lagos traffic in the evenings can be such a... Enjoy all-round entertainment in the company of dynamic maestros and let music be your therapy.
98.1, you'll love music, love life station.
It's your smooth drive home with soothing soul music, great spicy jazz, tune toppings of rhythm and blues, and everything else radio friendly that you enjoy. The Smooth
Okay, we're
Drive
back on in
every
10
weekday
seconds.
from 4 p.m.
This is Frank Dana, and you're listening to Smooth Breakfast on Smooth 98.1. Love music, love life.
Lagos Talks 981 is still focused on the health of our citizens and what they need to do. And so far, we've been digging into the conversation, and our guest, Dr. Folasade Fadare, medical practitioner and rep, Association of Public Health Physicians of Nigeria, still helping us get a better understanding. So, again, as we get into the conversation, I see calls coming in, but let's reestablish this so it doesn't look like at some point we say you're sick. Just walk down to the hospital when you've not paid because they say nothing is free in Freetown. So it means that you must have paid something to access it. That's what it is.
Well, you are right. Even in Freetown, nothing is free. Even if you get it free, somebody has paid for it or somebody has subsidized for it. If you buy into health insurance, you are sure you are not paying the actual amount. You are actually paying a subsidized price. But I want to tell you, certain things cannot be subsidized. Now the prices of drugs are skyrocketing. And that is why, as Association of Public Health Physicians, we are talking about prevention. We are talking about maintaining. Maintain your health, don't get sick. Eat well, rest well. Rest before you are laid to rest. Because the prices of drugs are skyrocketing. Equipment are skyrocketing. Even prices of running the hospital, buying diesel and reagents, those are prices that if you had it and you give it to a patient, they cannot pay. So whatever you are paying in the hospital, it has been subsidized. And that is why I will still tell you, go to the primary healthcare centers. Let's patronize the secondary facility. The teaching hospital is supposed to be a referral center. But because people don't know the difference, when they even go to the teaching hospital, nobody turns them back. Rather, they will tell them, go to the OPD side so that you can see doctor. Because many people don't know anything. They are just sick. They are going to the teaching hospital. It is a misnomer. A teaching hospital is not supposed to be your first point of call. You have to start from the primary health care. And that is why every hands must be on deck. We, the citizen, we need to know what is expected. We will help the government. As Association of Public Health Physicians, we are ready to help. Anyway, we are ready to provide data that will help policymakers.
Should there be or is there a quality management system that has been put in place to check some of these issues that patients have had to encounter, like maybe long waiting times or missing results, or maybe even health workers not being receptive to listening to the complaints of the patients when they come in?
Their quality, in fact, everything in Nigeria is quality control, except we want to lie to ourselves. And we let everybody know their rights. Patients have their rights. Health workers also have rights. And one other thing I want to use this opportunity is beg our citizens, don't be hostile to health workers. You get to the hospital and you are breaking on your health worker, it's not the best. I am not saying we are saints, but I want to tell you, we are licensed to help you. We are licensed to save life. Doctors take oath to do good and not to do evil. So also all cadres of staff. So, but if there are issues, we encourage people to come out and talk. Let us know where it is so that we can address it. You can't keep quiet. We are not saying keep quiet, but let your complaint, let it be constructive, not destructive, so that whatever you have gone through, the next person will not go through it. Even when it comes to the tests we have, they are quality control. We do quality control of our reagents, our equipment. They are calibrated, and there are bodies that go around periodically to ensure that if they give you a result, you are sure it is your result. If
What
it
about
is
with
drug,
regards to maybe long wait times? Like you've spoken of someone who went to a hospital in October and then they were given a date in February. Is there a review to ensure that patients don't need to wait so long?
where there is what we call ability to decide which one is emergency and which one can wait. As you know, we cannot do everything. So if there are emergency cases, emergency should be managed within 24 hours. There is no gainsay about that. But there are some situations that, though they don't look emergency, I will tell our citizens, don't keep quiet. Access care. Talk out. You can reach out to health workers. I don't think anybody in Nigeria does not know one health worker or the other. You can reach out. This is how I feel. And so you can have a fast track. But people may still have to wait because we don't have enough health workers. Specialists are leaving the country in drones. And that is why we have to do everything so that if, for like tomorrow, I want to go out, I will weigh it. Do I want to go out? Is the country okay? If it's not okay, I will jack my now. But if the country is okay, I will say, what I'm going to look for in Sokoto is in my Sokoto. So why am I going to? Because it is not green or greener where you think is green. This place may even, so we want our government to make this place greener and make it a greener pasture.
All right. As a patient, have you had any challenges, or what are the challenges that you've experienced in the course of getting access to healthcare for yourself, for your family? Let us know the challenges that you've encountered. 014489981. Good morning. Good morning, Saji. Go right ahead, please. Saji, are you there? Okay.
All right, that's a call drop. So, but then you got this point that Soji was trying to make also. So, we'd like to get you to respond and give a call into our guest this morning, Dr. Folasade Fadare, on the phone line 0809 That will be for WhatsApp messages. We'd also get calls across on 014489981 for calls only. So, you've got a response to what Soji had mentioned, and while responding, also connect that to it seems a recurring theme is the doctor to patient ratio in the country is what we're looking at right now.
Well, when we want to talk about doctor to patient ratio in the country, it is alarming. Lagos is even fair because most people will migrate from every other part of the country to Lagos State. So people in Lagos, if they are shouting, they have not seen anything. If they have gone to other parts of the country, they will know that it is better here. But I want to tell you, it is not real what we are talking about under universal health coverage. We are looking at, even doctors are burnt out. When you talk about waiting period, doctors are seeing patients. As I mentioned, I said some hospitals are oversubscribed, some are undersubscribed, and that is where we are asking people, please use the primary health care in Lagos State. If you go to primary health care, you will still get care, the essential care you will get. So don't just clog the secondary health facility. Don't go to the teaching hospital, because those ones are to take care of specialized complicated cases. So if we are able to do all this, we ensure that everybody have quality health care. And I want to say that you can learn what you can have a learning course from what is happening in Lagos State, so that we replicate in other places. I've been in consulting room when somebody will come from other parts, I don't want to mention name, and you say, well, what is wrong with mama? They say, that we are just coming, they sent money from us, and they will enter night bus and they are in Lagos because they have come to access health care. It's not supposed to be like that. Everybody everywhere need to get quality health care, and so it is our responsibility. If we have it right in every area, then there won't be a burnt out for one health worker. There won't be one health worker being under stress and maybe shouting at people, because we are human beings, to say the truth. And I want to tell you from my experience, patients are not patients. Once you call them patients, they have headache, they are not patients. Oh, you have not seen me at times. I say, is it that the condition has entered into their head? Because when they come, they are not patient. You see a long waiting area and you are shouting. For crying out loud, the doctor, the nurse, they are all human beings. So let us all appreciate ourselves. Let us work together. And I am a Nigerian that is very patriotic and optimistic. Nigeria will be better. The healthcare will be better. We will all play our role. Citizens will play their role. Health workers will play their role. Government too will play their role. We just need to be patient and everything will be okay. Thank you.
Will we ever have a healthcare system that is perfect, where everyone is covered, everyone is well provided for, everyone is taken care of? Are there any health systems maybe that we can emulate from some other parts of the world that could be like a model or a roadmap for us?
Let me tell you, there is no perfect thing anywhere. We all strive towards perfection. Even the healthcare in America is not perfect. Even in UK, it is not perfect. But we all know what we want. And what we want is quality healthcare for everyone, wherever and whenever they need it. Now let us use Nigerian sense to solve Nigeria problem. If we use American sense to solve Nigeria problem, we will fail, because we don't have what they have. But that does not mean we don't have anything. So what we have on ground, let us harmonize them well.
So finally, what are the healthcare workers in the system doing to ensure that, this is their part? Because everyone has a responsibility, right? Everyone has their part to play. So what are the healthcare workers in their own spaces doing to make sure that this access to healthcare can actually possibly become at least to a level that is acceptable for most people?
As healthcare workers, we organize CME to improve ourselves. We organize Zoom meeting just to ensure we share knowledge and skills. We organize trainings. And I want to tell you, Nigerian health workers, those of us that are still in this country, we will not want to go if we are well taken care of. And so every day we are crying out to government, please take care of us. It is not as if we are asking for too much. But honestly, to be a doctor is not easy. To be a health worker, not many people can work in the hospital. We just want the government to take care of us, pay us wages that we'll be happy about, that will take us home. Let us have the basic minimum. Let us be able to change our car. Let us be able to live in a good house. We are not asking for too much. Let the basic things be available for us, and we are sure Nigerian, they will have nothing but the best of us. Many of us, we don't have any other life. Our life is hospital, home, hospital, home. And what do we do in the hospital? To take care of patients. Let government help us to do what we know and we have been trained to do best. Thank you.
And that is it for Lagos Talks this morning. Special thanks to our guest, Dr. Folasade Fadare, medical practitioner and representative from the Association of Public Health Physicians of Nigeria. Thank you, Doctor, for coming through.
Thank you for having me. Nigerians, thank you.
Do stay with us. There's more.